Hi, my name is Melissa Hall, and I'd like to talk to you today about breast cancer awareness. The scariest words that I think that a woman can hear are that you have breast cancer. The negative stigma that's associated with cancer is overwhelming. My mother's been diagnosed with breast cancer. When the doctors actually said the words, I felt the air leave the examination room. I was emotionally devastated. My mother's diagnosis has launched my desire to understand the disease and try to find ways to assist my mother and our family through the challenge. Breast cancer awareness is essential in overcoming the fears associated with the disease and reducing the risk factors that make you more susceptible to acquiring the disease. What is breast cancer, you may ask? Cancer that forms in the tissues of your breast. The most common types of breast cancer are ductal carcinoma, which begins in the lining of the milk ducts, and lobular carcinoma, which begins in the lobules or milk glands of the breast. Signs of breast cancer. There are often no signs in breast cancer. Through regular self-exams, a woman or man may find a lump. Most times, it's not cancerous, so medical doctors should be consulted regularly. The signs and symptoms of breast cancer could possibly include lumps, hardening near the nipple, changes in the shape of your breast, density, discharges of fluid, skin changes on the breast. There's several things you can also do to avoid the risk of breast cancer. There are established risks and emerging risks. Established risks have been clearly identified and acknowledged by the medical field. Emerging risks are still being analyzed and reviewed by qualified medical institutions. So let's start with the established risks. The largest risk for breast cancer is being a woman. Women 9 times out of 10 are more likely to acquire breast cancer. Your age plays a large part of it. As you get older, you're more susceptible to breast cancer. 2 out of 3 cases of breast cancer are in women over 55. Your family history has a lot to do with it. If you have one first-degree female relative, your mother, your sister, your daughter, your risk is doubled. Genetics plays a role. There's a 5 to 10% of cases of breast cancer are thought to be genetic, abnormal genes passed from a mother to a child or from a father to a child. Personal history of breast cancer. If you've already been diagnosed with breast cancer, you're 3 to 4 times more likely to develop new cancer in a different part of your breast or the other breast. Radiation to your chest or face prior to the age 30, you have a higher than normal risk of developing breast cancer. Your race or ethnicity also play a large role in it. White women are slightly more likely to develop breast cancer than African American women, Hispanic or Asian women. Though African American women are more likely to develop aggressive, advanced stage breast cancer that's diagnosed at a younger age. Being overweight plays a large role. Overweight and obese women, especially postmenopausal, run a higher risk of women that maintain a healthy weight. Pregnancy history. Women who have not had a full-term pregnancy by the age of 30 run a higher risk than women who had one prior to the age of 30. Breastfeeding. Women who breastfeed for longer than 1 year run a lower risk of breast cancer. Your menstrual history plays a part. Women who started their menstrual cycle prior to the age 12 run a higher risk of developing breast cancer later in life. The same applies to women who go through menopause after the age of 55. Women who receive hormonal replacement therapy, it's referred to as HRT, were found to have a higher risk. In 2002, researchers determined the link between this therapy and breast cancer. So the percentage of women who take HRT therapy has decreased dramatically. Alcohol, research consistently provides proof that beer, wine, and liquor increase a woman's risk of hormone receptor positive breast cancer. Dense breasts. Having dense breasts can increase your risk 6 times the normal and make it more difficult to be detected by a mammogram. Women's lack of exercise plays a part. Research has linked a lower risk of breast cancer in women who exercise a moderate rate of 4 to 7 hours a week. Smoking is linked to higher risk of breast cancer in younger women. Also, there's been research to show a link between secondhand smoke exposure and breast cancer in postmenopausal women. Now, I think that's all the established risks, so let's go over the emerging risks. Low vitamin D levels. Research currently shows that low vitamin D may play a part in the control of normal breast cell growth and may be able to stop breast cancer cells from growing. Light exposure at night. Research is showing that women that work at night in factories, police women, nurses, medical doctors run a higher risk of breast cancer. In addition, women who live in areas of higher external light, street lights, run a higher risk. Eating unhealthy foods. There are really no foods that can cause or cure cancer. Some foods can make your body as healthy as possible, and they support your immune system and can keep the risk of breast cancer as low as possible. And this is as much as you could possibly do at this time with food. Exposure to chemicals is nearly impossible to show a definite cause and the effect for just any one specific chemical, due to the diverse combination of chemicals that are utilized in any one thing. But what research is showing right now is chemicals in foods, antibiotics, hormones, pesticides used on crops and livestock, mercury in fish, and industrial chemicals used in packaging food play a part. Chemicals in lawn and garden care, they play a part. Plastics. Research is showing that exposure to a chemical in plastic products such as bisphenol A, they refer to it as BPA, may cause cancer in people. Sunscreen. While chemicals can protect us from sun, research suggests that a certain exposure levels to the same chemicals in sunscreen can cause cancer in humans. Chemicals in water. Both bottled water and tap water may not be as safe as they can possibly be, and should be checked from time to time just to ensure your own safety. Cosmetics. Women who wear cosmetics. Researchers suggest that cosmetics pose a threat as a result of hormone disruptors found in some of the cosmetics. You can always do some research about the makeup that you wear and make sure that the hormone disruptors aren't actually found in the cosmetics brands that you use. You can find those online. I've taken a look at a few of them lately. After the diagnosis of breast cancer is the beginning of your challenge. After you take the time to process the diagnosis, you need to meet with your doctor and develop some healthcare plans. The treatment options that I'm aware of for breast cancer would be surgery. You can have a lumpectomy, where the doctor removes a lump from your breast. You can have a mastectomy, where they remove your complete breast. But when you have a mastectomy, usually that comes with reconstructive surgery and replacing the breast. That's just another option sometimes. Chemotherapy is a mix of medicines that a patient will receive intravenously. It kills rapidly dividing cells. The problem with chemotherapy is that it kills both healthy cells and cancerous cells alike. So it's very traumatic for most people. Radiation therapy is used after surgery. Radiation therapy is when you're subjected to a beam of radiation. It targets areas where they know that there's still cancerous cells, and they attempt to destroy those cells so that they don't reproduce. Hormonal therapy is also an option for some women, depending on the type of breast cancer that they have. They have medicines that are used to work against the breast cancer by blocking the effects of estrogen on cancer cells and lowering the overall estrogen in your body. As scary as the thought of breast cancer is to women, it's not the end, but another chapter in your life as a survivor. In conclusion, breast cancer can be overcome, as well as the fear associated with it. The battle begins long before you're ever diagnosed with the disease. You may never acquire cancer, but a healthy lifestyle is always the right choice. It's essential that we live the healthiest lifestyles possible, that we do not engage in habits that lead to our own demise. We don't smoke. You avoid alcoholic beverages and caffeine. Make sure that you eat healthy. As you get older, take vitamins and supplements. Make regular visits to the doctor so that you're aware of your health. Perform self-exams regularly. And I know that breast cancer is not the end of the world, but it's just another challenge that we may have to face in life. Challenges make champions. Our basic human instinct is to survive. Make the changes that protect yourself beforehand, and you may never experience the disease. If you don't do it for yourself, do it for your children, because no matter the age, you mean the world to them. Thank you.